Do you have knee pain? Could be one knee or both knees. A lot worse when you walk or when you go downhill or downstairs. At times you feel stiffness of the knees. Today we're going to be talking about osteoarthritis of the knees. This is a long topic. We'll be covering several aspects of it, including what is osteoarthritis of the knees, risk factors for osteoarthritis of the knees, the signs and symptoms, how do we diagnose it, how do we treat it, how do we prevent it, and supplements for osteoarthritis of the knees. We begin with what's osteoarthritis of the knees. So this is the knee joint. It's a joint between the two bones, the femur and the tibia. Within the joint there is the meniscus. The meniscus acts as a cushion for the joint, and we have a cartilage that covers the bone to prevent friction. So with osteoarthritis of the knees, you start losing the cartilage and from wear and tear, so from the use of the joint. So when you lose the cartilage, then you have increased friction within the joint, so it produces the symptoms. So the risk factors for osteoarthritis of the knees include, number one, the age. The longer we live, the more likelihood we're going to develop osteoarthritis of the knees. Typically, it starts after age 40 or 45. Women over age 55 are at a higher risk of developing osteoarthritis of the knees. Next is increased weight or obesity, because the knee joint holds the entire weight on top of it. So the larger the weight or more the weight, the more weight on the knee joints and the more likelihood to develop osteoarthritis of the knee joints. Then you have a genetic component to osteoarthritis of the knee joint. Then we talk about the use of the joint throughout life. So people who play sports, especially professional sports, people who use the joint excessively, people who go down on their knees and bend their knees during work, usually will have more likelihood to develop osteoarthritis of the knees. If you have muscle weakness of the leg, instability of the joint, if you have bone deformity, all of those, and at times even if you have back pain that causes instability of the gait, this all increases the risk of the osteoarthritis of the knee joints. Now, the symptoms begin with pain. The pain is a lot worse when you use the joints, when you walk, when you go downstairs, when you go down hills, because you put more weight on it. Now, this pain is usually gradual. It develops over years. It's not going to be acute over days or weeks. If it is, then most likely there is inflammation there. Then you have some stiffness of the joint. You feel that the joint is stiff and it's not mobile as it used to be. Then you can have swelling of the joint, mild swelling. It's not going to be excessive swelling. If it is excessive swelling, then it's most likely there is inflammation there. Then at times when you're going to have a grinding sensation, crackling sensation, or noise that you hear when you walk or when you bend your knee. And finally, you might have instability of the joint where you feel it's going to buckle and give out on you. You can have also some swelling too, that is mild swelling, as what we talked about. So though all of those are signs and symptoms of osteoarthritis, depending on what stage you are in, the symptoms can be worse. So now we talk about diagnosis. The diagnosis begins with the history, what the patient does for a living, the history about the patient, the age of the patient. Then we do the physical examination. You might have tenderness over the joint. You might have less mobility of the joint. You might have a crackling noise when you move the joint. Then we move to X-ray. X-ray will show some osteoarthritis. They're going to show narrowing of the knee joint. Now, if we need more and a better picture, then we order an MRI of the knee joint, depending on what we're going to do for treatment. But the diagnosis is based on the X-ray, could be the MRI. Now, the treatment of the osteoarthritis of the knee, we start conservatively. We start with simple steps. Number one, with exercises to strengthen the muscles of the leg that will increase the stability of the joint. We might do physical therapy. We might do bracing of the knee joint. Now, if there is pain, we might use the NSAIDs, the anti-inflammatory. So we can use the ibuprofen, naproxen, diclofenac. All of those can be used as an NSAID that reduce the pain. We use them for a short period of time, not long period of time. If the pain progress or the symptoms progress, then we go to intervention. Some physicians might use a steroid injection or hyaluronic acid. I use platelet-rich plasma or stem cell depending on the severity of the joint. Steroids will give you brief relief for weeks to months. Hyaluronic acid will lubricate the joint only for a few months, probably 6 months. with platelet-rich plasma or stem cell. Platelet-rich plasma can give you relief and can give you some remodeling over a couple years or a few years. Stem cell will give you the best results and give you relief or even remodels the joint over years. Last resort and finally we go to surgery. And for surgical intervention, we might do a scope if they have spurs to clean up the spurs, or you might go to knee replacement, but that's left as a last resort. Now we talk about how do we prevent osteoarthritis of the knees. Number one, we maintain good body weight. Ideal body weight. We exercise without excessively exercise. We strengthen the muscle, leg muscles, which particular exercises can strengthen and stabilize the knee joint, and that will reduce the likelihood of osteoarthritis and improve the symptoms if you have it. Then we go to taking supplements that might help with osteoarthritis and slow down the osteoarthritis, including omega-3, including collagen. Also, we might go to curcumin. And finally, we might go to chondroitin or glucosamine. All of those, if they're taken for a long period of time, can help prevent and maintain a good, healthy knee joint. Now, the most important thing is to maintain a healthy lifestyle, maintain a good weight, an ideal weight, and also exercise regularly without excessively using the knee joint, and that will help prevent osteoarthritis, or might help also slow down the progression of osteoarthritis. And finally, what I tell every patient is that if you know that you have osteoarthritis of the knees, if you have knee symptoms, and treat it early on, because you have more options and slows down the process, and do not wait until it's too late for anything else but knee replacement. Thank you.